Hello, I'm Jennifer Smith, your favorite neighborhood naturopath. Thank you for joining me. I am not a medical doctor, and this information has not been evaluated by the FDA. Therefore, it is not intended to cure, treat, prevent, or diagnose any disease. This is for general educational purposes only, so please speak with your healthcare practitioner for advice specific to your unique condition. So, I'd like to give you a quick overview of LifeWave's amazing phototherapy patch technology while sharing a few slides. So, okay. So I did mention phototherapy technology, and you're probably familiar with phototherapy in its modern form, which has been around for over 100 years, pretty much shortly after the advent of electricity. And hospitals have been using phototherapy for quite some time, primarily to promote rapid wound healing and in the NICU as well for babies who are born premature or born with jaundice. Estheticians have used phototherapy for quite some time as well to help stimulate collagen production to smooth wrinkles and scars, as well as physical therapists to help their patients heal more quickly after injuries, which is pretty much the same reason why a lot of professional sports teams, professional and amateur, college as well, are using phototherapy to help their athletes heal more quickly after injuries or to recover more quickly after a strenuous workout. But I always say that the original form of phototherapy is when we step out into the sun. When we do that, the sun triggers our body's ability to produce vitamin D. So it's not putting vitamin D into us, but rather it's stimulating our skin and allowing us to produce vitamin D. So these are all considered exogenous forms of phototherapy that you're seeing here on the screen, meaning coming from the outside. But what I'm here to talk to you about is a unique form of phototherapy that taps into your own body as the power source. And the reason phototherapy works so well is because we are light beings and we respond very well to light. So at the moment of conception, when an egg and a sperm meet, a flash of light occurs. And from that point on, we emit light from our cells, from our DNA for the rest of our lives, which is exactly why the military uses night vision goggles to track their soldiers. Those goggles are picking up on the low level infrared light that we all naturally emit as mammals. So, this form of phototherapy, as I mentioned, is tapping into your own body as the power source using these small non-transdermal patches. So, you're probably familiar with a transdermal patch, which is putting drugs, chemicals, hormones, or other substances into the body, into the bloodstream through the skin, through the dermis. So, examples of transdermal patches might be the nicotine patch or the birth control patch. There's the estrogen patch, even pain patches that contain fentanyl and other substances like that. So, those are examples of transdermal patches. But what LifeWave offers are non transdermal patches. So, nothing foreign enters the body. They're considered chiral, meaning reflective. So, they're reflecting back wavelengths of light that we all naturally emit to produce these beneficial changes in the body. And this is a unique patented wearable form of phototherapy. There are no drugs, chemicals, hormones, stimulants, nothing like that. And also, because of the fact that nothing foreign enters the body, that also means that there are no drug interactions. And so this technology was invented by a truly amazing man named David Schmidt. He is LifeWave's founder, inventor, and CEO, which is a very unusual, very rare combination. But he's the world-renowned leading expert in the field of phototherapy, and he currently holds over 200 patents. Most of those patches are in the field of regenerative medicine, but some of them are also in areas like emergency oxygen production and power generation. So, because of that, the military is very familiar with his work. He's done quite a bit of work for military contractors in the past, which is how all this came to be. Approximately 25 years ago, the Department of Defense contacted David and asked him to contribute to a project that the Navy SEALs were working on. At the time, it was the latest and greatest. It was a nuclear submarine, top secret. And just due to the nature of this program, the SEALs were working 30, 40, and 50-hour long shifts that they had to stay awake and alert for. So, in order to do that, they were using caffeine, amphetamines, whatever they could to help them stay awake and alert. And so, David hated the thought of that. So, he invented the energy enhancers. These were the first non-transdermal phototherapy patches that he invented. And what the energy enhancer patches did for the SEALs is they triggered beta oxidation to produce clean, stimulant-free energy through the mitochondria, the powerhouse of the cells. And it did exactly what they wanted. They loved the energy enhancers. It gave them the clean energy that they needed to get through those long, grueling 30, 40, 50-hour shifts. But then 9/11 happened. And so at that point, they lost their funding on that project. Everything had to be shut down and diverted over to Homeland Security. But fortunately, they gave David permission to get the energy enhancer patches out to the civilian population. And one thing led to another, and they made their way to the U.S. Olympic swim team. So you may recall during the trials back in 2004 when the judges saw these patches on the swimmers and they said, whoa, wait a second. They had been bringing home the gold, and the judges thought, well, maybe they're doping. We need to test them. And so they did. They tested them. But once again, as I mentioned, these patches are non-transdermal. So nothing foreign was entering their body. They were just reflecting back wavelengths of light. So they had to drop it and allow them to keep their metals, and the rest is history. So at that point, word got out, and more athletes were using these patches. But you certainly don't need to be a professional athlete in order to benefit from this technology. So that's how all this got started. And due to the success of the energy enhancers, David got back into the lab and he started producing other phototherapy patches, one after another, over a period of years until after 10 solid years in the lab of working on this one patch, he perfected the X39 patch. And what the X39 patch is known as is the stem cell patch, but it does that in kind of a roundabout way, which I'll get to. But first, what are stem cells? Well, stem cells are the master building blocks of the entire body. And when babies are born, they're born with an abundance of stem cells, which is why they're born with beautiful, clear skin and bright eyes. And they almost seem to be made of rubber, when they're learning to walk and even ride bikes, things like that. They can fall, and what would be a major injury to an adult, they just bounce right back up like nothing ever happened. And that's because they are full of stem cells at that point. Your stem cells have the ability to differentiate and become whatever the body needs, whether that's liver cells, eye cells, heart cells, kidney cells, brain cells, and they naturally repair and regenerate your body as well. But one thing is, I've always been fascinated with the science of stem cells, but what I did not realize until a few years ago is that by the time we reach age 30, our stem cell activity has slowed way down to about 50%. And then by the time we reach age 60, we only have about 10% of our stem cell activity left. So we still have stem cells in us, but they've just slowed way down, just like a lot of things in the body do, which kind of leads to degeneration. So what the X39 patch does is it just kind of wakes all that up by the virtue of elevating the GHK copper peptide in the body. So you may have heard of people getting peptide injections now, or even stem cell injections for that matter. That's not what this is. So this is elevating your own native endogenous levels of GHK copper peptide. And what that does is it resets over 4,000 genes to a younger, healthier state, and then elevates your tired old dormant stem cells at the same time. They rise in tandem with that GHK copper peptide, which is also slowed way down with age. And so this combo is really known as just the fountain of youth, really, to repair and regenerate and just heal the body. So and I should say that these patches, they really don't heal your body, but what they're doing is they're giving your body the tools that it needs to heal itself. And so some of the general benefits of this includes improved cardiovascular health, reduced pain and inflammation, enhanced wound healing, increased energy and vitality, greater mental clarity, deeper sleep, and brighter skin appearance. So these are just some of the general health benefits, and I'm pretty sure I've experienced every single one of these. But you'll hear more specific things from people. But what this does is, again, gives your body the tools it needs to heal itself, which is going to show up differently for everyone. And I'll show you a few examples here in a moment. But, first, people often ask me, well, what are the ingredients of the patches? I'm allergic to everything. Well, again, they're non-transdermal, so that is not a concern. However, I was curious as well. And LifeWave does make 10 different patches currently. And what makes each of those 10 different patches unique is in the center, there's a crystal lattice structure. So while they may look alike on the outside, that crystal lattice structure on the inside, which you can really just see under a microscope, that is what's different. And that structure is formed from a combination of stereoisomers of primarily amino acids, but also some salts, sugars, water, oxygen. And that's what forms that structure, which knows which wavelengths of light to reflect back into the body to promote these beneficial changes. And that structure is encased in a latex-free polymer shell with hypoallergenic 3M medical grade adhesive. And 3M estimates that only about 1 in 10,000 people are allergic to their medical grade adhesive. But if you're one of those unlucky 1 in 10,000 people, that's all right, because the patches work frontwards and backwards. And they also work if they're within about 3 inches of the body. So you can place the patches inside your shirt, inside pockets, between shoes and socks, or a number of other locations. But with that being said, once you remove a patch from your sleeve, we call these a sleeve, and place it on the body, you need to store your unused patches away from the body so you don't activate them. And perhaps the one of the biggest draws to me of this technology that I learned is because of the fact that the patches are non-transdermal, that also means that there are no drug interactions to worry about. And so, as a matter of fact, what happens is a lot of people start patching and they find that, gosh, maybe I don't need so much of this or that medication after all, and maybe I don't need this one altogether. But that's certainly something you'll want to work with your medical doctor to determine. But these patches are so easy to use. You simply wear each one for 12 hours a day, and you can place the patch in a number of locations. The two most common recommended placement locations are either your C7, which is that cervical 7 vertebrae that sticks out when you bend your head down, or a location that's about 2 finger widths below the navel. Either of those two locations are great locations because the patches do work systemically and there are some nice nerve bundles there. And also, these are the placements that were used in the clinical studies because we have many clinical studies used on these patches, and they're all double-blind placebo-controlled studies, gold standard. But in a controlled study, each participant, regardless of whether they received the placebo or the real thing, the patches had to be placed in one of these two locations. So that's why you'll see these two locations recommended most commonly. But if you've got an area that needs a little extra attention, perhaps your shoulder hurts, you can certainly place the patch on your shoulder, and it's going to be a little more intense in that area. But you simply wear them for 12 hours on and then remove the patch for 12 hours and repeat the next day. And do all this while you're well hydrated, preferably with some healthy electrolytes and at least one of your daily glasses of water. Well hydrated, by the way, a good rule of thumb for that is to drink half your weight in ounces per day of good clean water. So in other words, a 150-pound person would drink 75 ounces of water per day. And your 12-hour window might be 7 a.m. to 7 p.m. It could be 10 a.m. to 10 p.m. But regardless, you'll apply your patch to clean, dry skin at, let's say, 10 a.m. Wear that for 12 hours. while you're well hydrated, and then at 10 p.m. you can remove it and toss it in the trash because again, it's organic materials that start to break down after being on a warm body for 12 hours. Or there are still a few hours left that you can place the patch on your pet for them to get a little benefit from. And then the following day, just start the process over again. So, just a few examples of how these patches benefit people differently because we're all so different. And so, I can tell you that you're definitely going to benefit from this technology. I just can't say exactly how or when you'll feel it, how that's going to show up for you because we're all so different. But the gentleman in the upper left, no, we are not supposed to be using disease names, diagnosed disease names, but this is just what he shared with us with his progress. But he had a skin condition, and over a period of 12 months, it just gradually disappeared. And not only did the skin condition go away, as you can see little by little, but he looks like an entirely different person. He looks much younger, he looks much happier. And so that's pretty amazing results there. Something similar with the gentleman down below. Again, he looks so much younger, looks like a whole new person, and that's over 11 months there. In the middle here, Dr. Stan, I really need to get an updated picture of him, but same thing. He looks so much younger. You can see reduced inflammation, a more youthful appearance, brighter eyes. The woman to the right, her before and after pictures are reversed, but she'd come up to me after a presentation once at an event and she told me, she said, I noticed that my neck was looking younger, fewer wrinkles, and I didn't realize just how dramatic the difference was until I pulled up an old picture. So yeah, that's a beautiful results there. And I just imagine with all these results on the outside, imagine what's going on the inside. Case in point, a dear friend of mine on the upper right here, she is an amazing licensed massage therapist, and she was feeling really rough. Let's say she could only see one or two clients per day in the morning, and then by noon she was done. She would have to take at least a 2 hour nap just to get through the rest of the day so she could enjoy dinner with her family. And her hair had been falling out in clumps. You could see her scalp on the back. And she had gained 30 pounds, just not from doing anything different, no change in diet, packed on an additional 30 pounds in addition to the overall exhaustion. And let's just say she had developed a thyroid condition, and she really didn't feel anything at all for the first 4 months. At least she didn't think she did. And then right around month 4 is when she noticed the scale was changing in her favor. And she also noticed that her hair, she called it alfalfa sprouts, her hair was starting to grow back in. And you can see with her as well, the inflammation in her face was gone, and she just looked so much younger. She had regained her energy back and just really got her life back. In this next slide here, this is Marcy in the upper left, and I also need to get some updated pictures of her. But back in 2020, when she was introduced to this technology, actually I think in 2019, toward the end, she was introduced to this after suffering two different bouts of a pretty severe disease, and she had undergone chemo and radiation both times, and she was feeling pretty rough after that. She said she had just kind of locked herself up in the house and was feeling sorry for herself, not feeling good. Things were looking pretty bleak, and a doctor shared these patches with her and said, you need to start doing this. And you can see how her life changed, and again, she's got her life back. The gentleman in the lower left here, his hair grew in much thicker, and also it started to revert back to his darker, more original color. And I've seen this happen time and time again with people. The young man in the bottom middle here, he had endured a snowboarding accident and had a job interview coming up, and so somebody shared patches with him, and you can see he had dramatic healing within a short 3 day time period. So he was able to walk into that job interview and not look like he had just been beat up. The woman over to the right, just above him, it had dramatic improvements in the décolleté area. And, I always say that's the fastest way to tell a woman's age, regardless of if she's had, a facelift or Botox or fillers or whatever else everybody gets these days. You can still see it in the décolleté area. And she was not happy with that, but she had some really wonderful results there. And then perhaps my favorite is the sweet man in the upper right. His name is Bill, and he had undergone chemo and radiation years prior, which wreaked havoc on his body. And to make matters worse, he was involved in a freak accident where a large tractor fell on him, and he was pinned underneath. And so after that, he was just on a lot of pain meds and the oxys, and he had developed tremors, and he wasn't even able to walk unassisted and get a glass of water. It would spill everywhere. The tremors were so bad, and he was pretty much bedridden for about 20 hours a day sometimes. And when his wife took this picture here on the left and sent it to their adult children, she was afraid that would be the last picture she would ever take of him alive. And that certainly wasn't the case because he was introduced to the patches about a month after that. And as you can see, dramatic difference. He was able to start driving again after a while and start working out in the yard again, which is something he loved to do. So these are just examples of just different people with very different experiences. And again, I can't say how this is going to benefit you because we're all so different. So, in other words, a person who's had I don't know, their gallbladder removed is going to benefit differently from this technology versus someone who's suffered a serious injury and has had some surgeries versus a person who just has some general aches and pains and inflammation and maybe poor eyesight. I don't know, but we're all so different, and the benefits are going to be a little bit different for everyone. But I always just say, as long as you're consistent and patient and hydrated, don't quit before you get your miracle, because these patches work from the moment you place them on your body. They just might be working on something deeper that you're not even aware of. It could be repairing blood vessels or repairing a liver, a kidney or something like that before you may even feel it or may even see it. So, just to summarize, this is a wearable form of phototherapy that taps into your own body as the power source. And this is a 21-year-old company that's headed up by the inventor, who is also our founder and CEO, a truly amazing man. It's an American based company, but we do distribute to 82 countries. And these patches elevate your native or endogenous GHK copper peptide, which rises in tandem with your stem cells without the need for any kind of injections. There are no side effects, no prescriptions needed, no drug interactions or dosing or ethical concerns, nothing like that. And your pluripotent stem cells go to work systemically to repair and regenerate your body in the order of highest importance. So, like we always say, you can't pick the fix. Your body was so divinely designed. It knows what to do when you give it the tools to heal itself. It just may not necessarily be in the order that you want, but rest assured, it's in the order of what's most critically needed in the body. So I hope that gives you a good overview of how this technology works. And there is a link below to order these patches yourself, along with my contact information. However, if someone else invited you to this to view this video, please connect with them, and they can help you to determine what patches might be the best for you to use, and help you get the best pricing on that, because we love to help people with that and help kind of guide them through this, because there's never been anything else like this. And I've seen absolute miracles with this technology. So I would love to hear how this works for you as well. So thank you so much for joining me. And I look forward to seeing you back on some more of these that I do. So thanks again. Bye bye.